Hello, people. What's going on? It's your boy, Platinum Maxwell again, coming at you with the V-Blog Spot Report, CEO of Platinum Travels, aka, you know it, you know it, Chris Long. Smash the like, subscribe to my channel. I'm back on here to take care of a few things in the mental department because a few of you don't want to recognize and realize that there is a problem. So, the thing about that is, if you don't recognize that there's a problem, then you never will fix the problem. All right, so let's begin, shall we? I wanted to discuss a hidden disorder that I don't think anybody is even aware of even having. Let's talk about it in two aspects. One aspect, the first one, can be your lover, boyfriend, or girlfriend. And then the other way, it could be a best friend. So all you have to do is apply the bullet points to whether it's a best friend that's treating you this way or it's a lover. It's called Othello, the Othello syndrome. Yes, OS. It's a psychiatric condition characterized by delusional jealousy. Yeah, let me get this light out of my face. Great, great. All right, cool. You can see me now. Characterized by delusional jealousy, wherein an individual becomes irrationally convinced without evidence that their romantic partner is unfaithful or doing things malicious to them. That's on the aspect of best friend, whereas it's a lover. So, put in relation to the terms without evidence, yes, that their romantic partner is being unfaithful. Yeah, the term originates from the Shakespearean play, the tragic play Othello, where the protagonist murders his wife, Desdemona, due to the unfounded suspicions of infidelity. He was wrong about it, of course, and by then it was too late. So, yeah, in this term, that's how this thing works. It could be too late before you recognize that you actually done something wrong. So, in clinical terms, this syndrome is classified as a delusional disorder of a jealous type. So DSM-5, or it may manifest as a symptom of other psychiatric or neurological conditions. So the core features of Othello syndrome, one, pathological jealousy, or as shall we call it, morbid jealousy. Hey, you're from Pakistan. Great, great. Hello, hello, everybody. Smash the like, subscribe to my channel. In pathological morbid jealousy, the individual hurls an unshakable belief in their partner's infidelity despite the lack of objective evidence. Unlike normal jealousy, which may arise from situational triggers, this delusion persists even in the face of contradictory proof. So like nothing is going to convince this person that you're not cheating. So that's pathological. That's when it gets kind of hard. Yeah, it's wrong. Delusional thinking is another form of the jealousy that is merely exaggerated but reaches psychotic intensity, meaning that the person cannot be reasoned out of their conviction, and they may interpret benign actions such as delayed text responses or unanswered phone calls as proof of betrayal. Not exactly, and not exactly true. It's not true. In most cases, it's not, but sometimes it may be, and that is only after it being proven. So, unproved it doesn't mean that it is. Behavioral manifestations, as in hypervigilance, excessive monitoring of a partner's activities, such as checking their phones, following them, questioning them every time they're walking out the door, things of that nature. Interrogation, repetitive questioning, about the partner's whereabouts or their associations, not letting them have a place apart from the relationship. So it gets kind of old, and it makes someone hard to love that person when they go. And then there's the aggression thing. Aggression is verbal or physical violence stemming from their perceived betrayal that you may have or may have not, deeming the case, done to them. So that's when their delusion comes in. Now, the etiology or causes of this would be psychiatric disorders, which may be just mental, often linked to a paranoid schizophrenia, delusional disorder, or severe personality disorders, paranoid, or the borderline traits of paranoia. Then there's neurodegenerative conditions, seen in dementia, when you can't remember things, especially frontal temporal or Alzheimer's, or Parkinson's disease, sometimes triggered by dopamine enhanced medications and things of that nature. So it's a very delicate situation, and it should be handled with great care. Then there's substance abuse. So if you're adding that to the fire, then that's more fuel. I can't stress it enough to not do those things, but you do what we must. Substance abuse, chronic alcohol, or use of stimulants. I hate to even mention this because cocaine, marijuana, it can exacerbate or induce delusional jealousies and thoughts, things of that nature. Differential diagnoses would be that normal jealousy, non-delusional situation or responses to the evidence found, that's just normal jealousy. There's obsessive jealousy, okay, the OCD related, intrusive thoughts about infidelity, but with no insight into their irrationality. So they have no proof, but you're a cheater because they feel that they're being cheated on. It's not true. Borderline personality disorder. Watch out for this one. This is the fear of abandonment. It may mimic jealousy, but lacks fixed delusions. They're just worried that someone better than them may come along and you may leave them. And it's just that their jealousy is fear of abandonment. So you don't blame them for that. Everybody is afraid of being left. Everybody is afraid of being alone. Me personally, the way you deal with that is to trust, always trust, up until the person proves untrustworthy. If they haven't done that, then you can carry a relationship for the long haul. All right? So psychological and neurological underpinnings would be projection, dopamine dysregulation, frontal lobe dysfunction. These things are Freudian theories, suggest unsuspicious fears of one's own infidelity may be displaced onto the partner. That means that they're projecting the things that they do onto you. And this is very common in a relationship that I see for the most part, and it ruins lots of relationships. Now, dopamine dysregulation, overactivity, and mesolimbic pathways, which is a very deep thought that it creates the dopamine type of situation within the body that they just can't help that feeling. That feeling is the feeling that they're feeling. And that's what it is. That's what they're going to say it is. Frontal lobe dysfunction, impairments in reasoning and impulse control in dementia, reduced capacity to elevate suspicious logic thought pattern. Now, thinking of this, when you evaluate logical thought and you have suspicions, then you have to have proof behind the suspicions. You can't just accuse somebody, like, hey, you robbed that bank. No, I'm standing in line. I'm at the ATM. That's how it looks. That's exactly the analogy. It looks like that. There's clinical and ethical implications that could escalate. And then there will be a risk of violence. Now, with the Othello syndrome, by it being associated with high rates of domestic homicides and violence, that's when things aren't treated properly and they escalate past one's control. So treatment challenges, cognitive behavior therapy, okay? You can address your maladaptive thought patterns and the delusions. You can get them to, and you can resist delusions. Purely psychological intervention helps one's healthy thought pattern. Okay, underlying conditions as alcoholism or using controlled substances, along with schizophrenia, it must be treated concurrently. You have to take it upon yourself to not abuse alcohol, to not abuse controlled substances, especially if you know that you have these underlying mental issues. Now, literally versus clinical context. Shakespeare's Othello tells us it exemplifies the destructive potential of unchecked jealousy. All right? And that's what the play told us about. If you've seen the play or know anything about the play, you will know exactly what the man was feeling. But the clinical syndrome differs in that. It is rooted deeply into psychopathologic, thought pattern, not mere emotional access, okay? It's modern psychiatry frames that we have to concentrate on to help one another be together. So it is a loss of reality testing capacity requiring medical intervention. That's how, I meant to explain it that way at first. So in summary, Othello syndrome represents a severe break from reality, where jealousy becomes a fixed, dangerous delusion. Its management demands a multidisciplinary approach, blending pharmacotherapy, psychotherapy, and often legal safeguards for the partner. So all that in play, along with you loving this person, it works if you work it. People, this has been your boy, Platinum Maxwell, CEO of Platinum Travels, aka Chris Long, coming at you with the 15-minute V-Blog Spot Report, and that is Othello Syndrome. Peace, I'm out. Don't forget to smash the like and subscribe.